Hello, everyone. Thanks so much for joining us. My name is Nicole Nifo. I'm one half of Perinatal Massage Therapy Education. Thanks so much for joining our conversation today. I'm here with the lovely Jessie Vandelube, who is a new mom for the second time. So there's a little baby just below the picture, so you may see a little hand come up. But Jessie, please introduce yourself to the audience.
Hello, everyone. So my name is Jessie. I'm a massage therapist out of Hamilton. My clinic is Gentle Core Perinatal Massage. And pretty much just what I wanted to chat about today was about how, we kind of all have this idea of cesareans being very sterile and clinical. Yeah. And I was fortunate enough to have kind of like a holistic, a little bit granola version of it.
Nice.
My first birth experience was a little bit traumatic. I had planned to kind of go, with the flow, and I wasn't, banking on no epidural and going natural, but I kind of wanted to give it my all.
Yeah.
And then I ended up getting induced, and I had ultimately ended up in the C-section because my son's heart rate was dropping.
Yeah.
So we decided it would be for the best. But the postpartum care was really difficult. So I wasn't able to breastfeed because he had a lot of fluid. So he was really tired and dopey, and he never latched. And then I was stuck in the hospital. So they wouldn't let me leave for 5 days. It was just, an overall traumatic experience, not exactly the warm welcome to the world that I was hoping for my son.
Yeah.
So this time around, I decided I wanted to really put as many team members in place to make sure that I had the birth that I was really looking for. I decided not to do a VBAC, and that was just a personal choice based on, my history and the experience that I had with it.
Yeah. So who was your team that you felt was important to bring into your birth this time around?
So I had an OB, Dr. Dustin Kostescu, which is an awesome OB out of McMaster.
Yeah.
And I kind of gave him an idea of what I went through with my first birth and how I didn't want, a repeat of that.
Right.
And he kind of gave me there she is. He gave me the option of also using a midwife.
So he brought up that as an option.
Yeah.
Wow.
So I didn't even know that was something that we could do. And he kind of just informed me, this is something that they're trying. So it's a new project that they're trying.
Wow, I love it.
Yeah, to partner with midwives and just kind of give a bit of a different experience. So because I had a midwife, I was able to do skin to skin right out of the womb, which was really cool. I did not expect that at all. And then I decided I wasn't going to do the whole, pumping for 6 months and bottle feeding, because that's what I did with my son. Yeah. So I, instead of using the lactation consultants out of McMaster, who I didn't have a good experience with, I found my own lactation consultant, and we just put a plan in place to make sure that, it happened this time.
Yes. Because that's something that commonly comes up with patients who've had either traumatic birth or whose babies have come out, not breathing or have had a bit of trauma themselves, and people who've had cesareans, because especially if the baby was, taken out before 40 weeks, like there's like that gap there that needs to be filled. And sometimes people need more of that one-on-one support with breastfeeding. They don't even know that that's available. They think, I just go to the ones that are free that the hospital provides. And, it's like having a nurse during delivery or an obstetrician during delivery. It's like, you don't know who you're going to get. Right. And if they kind of meet your needs as a mother, because do your personalities match and that sort of thing, like that makes a big difference with how successful your breastfeeding outcome can be.
Oh, for sure. And the unfortunate thing with the McMaster ones was that I had 2 lactation consultants that weren't consulting with each other on what they were doing with me.
So they're saying different things.
Yeah. So I had to stay in the hospital for 5 days because they were like, well, you don't have a feeding plan put in place. He's still, he's eating off of a spoon. And I was like, well, what am I going to do about it? Like, that's not my, this is my wheelhouse. I need some help.
Yeah.
So with the woman that I contacted, her name is Addie Sandink, and she's out of Burlington. She's wicked. She's like the warm, just like very soft spoken. She's older. She's got a lot of experience, and it was just exactly what I needed, as opposed to, like, it was very handsy and
Yeah.
cold, and it was just a
You were
painful
being
experience to go.
nurtured. You were being more
Oh yeah,
nurtured than lectured
totally.
at. Yeah. Which was
Yeah,
important.
for sure.
So, with your experience during the cesarean this time, having a midwife, um, not compared to your first experience, because, like you said, you had been through labor, it was a bit traumatic. So,
Yeah.
through what you've heard about other people's scheduled cesareans, maybe from patients or friends, how
Mhm.
has this been different having a midwife in the room during a delivery, a cesarean delivery?
So from what I heard going into it, like, everyone who had either a scheduled or a second C-section were like, "Oh, this is going to be way easier than your first,
Yeah.
just so you know."
Yeah. Everyone
And
says that.
like, yeah, which was a huge relief,
Yeah.
because you're not going through labor, you're not exhausted. Um, but I only knew one other person who had been able to do skin to skin.
Right.
And other than that, I hadn't heard of that really being an option. Like, I'd seen it like on TV and stuff, but I didn't know anybody who actually experienced that.
Yeah.
Um, so it was a lot different than the experiences that I've heard of, mostly just from within my practice or my girlfriends, or like my mother, things
Yeah.
like that,
Yeah.
right?
Yeah.
So it was really eye opening, that it's like, oh no, this is an option. We don't all have to be afraid of having C sections, because everyone's so panicked about how awful it's going to be, and it doesn't have to be that way.
Well, I think, the first thing is that it is, major abdominal surgery. So
Yeah.
it does have to be taken seriously because it's
Yep.
surgery. But
For
on the
sure.
other side, it's not just surgery, it's birth of a child into this world. And for people
Mm.
who feel like that's such an important gateway into life, and who feel like there should be certain traditions around that, or, just feeling like it's a loving, welcoming environment. I know for me, that's really important.
Yeah.
And I think being able to have your midwife there, because I had a midwife with my first, so
Hmm.
she was involved in the process when I had my cesarean. But I think with your situation being not emergency and it was planned, like having the midwife there to just kind of like set that tone of it being just more holistic and not this like cold surgical, event. It's actually a
Yeah.
birth. It felt like a birth
Oh,
and not like
definitely.
surgery, right?
Yeah, and it's a bit difficult because you can't put this many steps in place when you go in assuming that you're going to have a vaginal birth, and
Yeah.
you have your birth plan, and
Yeah.
it takes like a hard left, and you end up having a C-section, and you had no, like, you weren't prepared for it at all.
No,
Like, that's a
no,
bit difficult.
totally. Yeah.
um but if you are faced with the option of having a second, um just like the idea of, like, you can take your first birth experience that maybe didn't go as well as you wanted it to,
Yeah.
and make turn it into something that is enjoyable. So this was like night and day, um a night and day experience from my first.
Yeah.
And so I'm just trying to let people know that it's like there's so many options. We just need to ask for them, just advocate for
Yeah.
ourselves.
Yeah. Yeah. And I think, VBAC is definitely something that is a lot more of a popular topic.
Yeah.
But it's not ideal for everybody. Some people
Mhm.
literally just cannot even attempt it. And
Yeah.
others are maybe just kind of, they have a lot of fear in that way. And I think that's okay because you do what's right for you, but it doesn't mean you have to sacrifice things like, having it to be a warm environment, being informed, feeling like you're just in really good hands that are taking your needs into account when the birth is happening, right? And I think, having an
Yeah.
OB that's so open like that is just really amazing. I've heard of many stories coming out of Sunnybrook Hospital in Toronto,
Mhm.
um, where they've actually, the CBC has gone and interviewed the doctor there because they've done research to show
Yeah.
that the outcomes are so much better for breastfeeding or for maternal mental health, for the
Yeah.
bond between mother and child, like so much better when you have that kind of gentle cesarean approach, which is this whole like family centered, everyone's involved, there's a lot of communication, and baby is put to mom's skin right away.
Yeah.
Because a lot of times with surgical births and even vaginal deliveries, babies are kind of taken away and cleaned up and then wrapped up. And that's just not mimicking what nature is like. Nature is like
Mhm.
baby comes straight to mom.
Yeah.
And there's so many benefits of helping to encourage that in a cesarean, and you obviously experienced that, and you were feeling the difference in this postpartum period, because how old's Emerald now? She's only 4 weeks, or
She's almost a month, so she'll be
yeah,
a month on the 31st.
yeah.
And it's just, I mean, as much as having a toddler and a newborn is
We didn't say that part was going to be easy.
yeah, exactly. But just the kind of like the confidence
Yeah,
that you get, right? Because you're so hormonal in
yeah,
the beginning. The last thing you need is everything to like, well, what you think is everything going wrong in the moment, where it's like, I can't feed my baby, and now everybody's looking to me for the solution to this
yeah,
problem, and it's like, I don't know how to breastfeed. Like,
yeah.
we assume that it's so natural, and it's not. It
No,
takes time, to
yeah,
learn. And even with this, it was so funny to go from, speaking to my lactation consultant in the hospital, and then she'd be gone, and then the nurses would tell me what to do, and it was completely different things. Like, they would tell me
right.
completely opposite things to do. And I'm sure that, the nurses' options work for some people, but the lactation consultant just kind of hit the nail on the head. And obviously, like, that's her bread and butter, right? It's the
Yeah, it's what
nurses.
she does. Yeah,
Yeah, the nurses only know so much, and that's
yeah,
understandable. But that's very, like, that's difficult to sift through,
yeah.
when you're hormonal and have no sleep.
Yeah, I know it is. And I think during that period, like during pregnancy, during birth, definitely in postpartum, especially the first couple of weeks, first 6 to 8 weeks even, when you are very hormonal and very emotional and vulnerable, I think
Yeah.
anything anyone says to you that doesn't hit right with you, like you don't let go of that. You can hold on to those words or that sentence for the rest of your life and always
Oh,
remember that somebody said
totally.
that to you, right? So I think it's
Yeah.
so important that anyone who's working, even us as massage therapists, working with patients during this perinatal cycle, it's so, Michelle and I always talk about like the language that people are using is so
Oof, big
important,
time. Yeah.
because they don't realize like you can say that one thing that just takes your patient into the wrong direction, and they just don't want anything to do with you after that because it made them feel bad about themselves or unsupported.
Yeah, that's
And
right. And
yeah,
even, I was just gonna say, even like in my own experience,
yeah,
because I kind of knew right off the bat, like, I was leaning towards a C-section.
yeah,
And in Canada, I find it's a bit different in the States, but in Canada, it's like, well, why wouldn't you try for a VBAC? It's like,
yeah,
if there's nothing wrong with you, why wouldn't you? In the States, it's kind of like, well, whatever, like, have another C-section. It's a
yeah.
bit of a different kind of birthing culture there. But even just the amount of patients that I would have be like,
Mhm.
oh, like, why wouldn't you just try to give birth instead of having a C-section? It's like, well, I still feel like I'm giving birth, but thanks
You
anyway.
are giving birth, right?
Yeah, of
I think
course.
you know what the what. Okay, so I see what you're saying, and I know people consider that. I don't have a lot of patients in my practice that do attempt VBAC. Some do, and they're very successful.
Yep,
A CBAC is a cesarean birth after cesarean, and that's more
yep,
common.
yep,
But there's a one really big risk, which is uterine rupture, and
yeah, yeah. It's
I
real.
and that's what I experienced myself just
Yeah.
from being in labor for over 40 hours and having such a large, like almost 11-pound baby.
Oh my
During my
goodness.
cesarean, with them pulling really hard at him after they have already done the incision for the cesarean, that's when I experienced the rupture. And, the
Wow.
recovery of that is like, well, it's a very scary situation to be in.
Of
It's
course, yeah.
it's it's very life threatening, and the recovery from that is so difficult. Like the
Hmm.
first couple of months, the effect that it has on your digestive system, the effect that it has on your hormones, like, hopefully baby's okay. You know what I mean? Like it's quite
Yeah,
the risk. So I can really understand now why, I've always said that, if you can have a vaginal birth, do it. But I
yeah,
mean, a lot of people are not attempting their second birth at 5 years. My son will be 5 years old
yeah,
soon. And it's like, at that point, yeah, sure, it may be a great time to try it. Most people
yeah,
are trying it under 3 years old, and that may not be enough time if you're reading some of the research that shows that it takes at least a year for our bodies to recover,
yeah,
right, from pregnancy and birth. After a cesarean, let's say it's even longer. Most people are already trying for a second, and then they're going to try for a VBAC. Maybe that's not enough time for the tissue to heal and be strong. And so I totally understand why people don't attempt VBACs, because to think about putting yourself through labor and what if it doesn't happen as a vaginal birth and you put yourself through that again,
Yeah.
Whereas
And
knowing
that was,
that, yeah,
yeah, that was exactly what I was thinking, where it's like,
yeah,
how would I be okay with the idea of
yeah,
potentially going through
yeah,
that whole experience again?
yeah,
And then again, if I were induced again and
yeah.
to have all those fluids in the baby and then potentially not breastfeed, it's like, can I pump for half of a year with a
That's
toddler and a
hard. Yeah,
newborn? Like
yeah,
that's so much
yeah,
to ask of myself. Um, so it just made the most sense for me, but I agree with you, though. I don't think that there's enough explanation
no,
to these women, where it's like,
yeah,
a VBAC is an awesome thing if you can do it, but if you're not up to it, that's also okay. Like,
yeah,
just to do what you feel is comfortable. And
yeah,
my doctor, when I first came in, I was kind of on the fence, and he was
hmm,
like, what I say to women is, book your C-section, see how you feel after that. You can always cancel it. If you feel
hmm,
relief that that you're having a C-section and that's out of the way, then you're doing the right thing. If you now feel anxious because you've got this surgery coming up and it's not sitting well with you,
yeah,
you can always cancel it and try for your VBAC. But
yeah,
just give it a try. Like, see
yeah.
what makes you feel best. And if it's a C-section again, there's nothing wrong with that.
No. I think that it's really important, we talk about, because I'm also a doula, and, in my doula training, they talk a lot about fear. Fear is like one of the biggest things that push us to make decisions during our pregnancy and birth
Oh, big
planning.
time. Yeah.
And I think that, a lot of fear is instilled on us as young girls or teenagers with these birthing videos they show in school, which look really scary. Or
Yeah.
you watch these, Hollywood videos of people just screaming their head off, and it creates a lot of fear. And I
Oh,
think,
yeah.
and that's for vaginal delivery. And I think on the other side of things with cesarean, there's a lot of fear because, am I going to be looked at as not actually giving birth to my baby? Which, yeah, it's called belly birth.
Yeah.
It's called belly birthing.
I
And your
know.
vagina is not saved because there's still pelvic floor issues after a
Oh, yeah.
cesarean. You know what I mean? Like, it doesn't
Exactly.
save you. So when I hear people from other countries like, oh yeah, they like, in a patient of mine told me in I think it was Indonesia, the
Mhm.
cesarean rates are so high. Hi. You can do a little face. The cesarean rates are so high because women think that they're avoiding damage to their vagina. Yeah, sure, you're not going to get
Oh.
labial, tearing. Like, your labia will look fine, but it doesn't save
Yeah.
you from actually pelvic floor dysfunction.
Oh, yeah,
If
yeah.
anything, like, you're more at risk for it because of all the scar tissue. But
Yep.
I think, creating just a nice environment for people to talk about cesareans is really important because the rates are high. I don't
Mhm.
agree with unnecessary cesareans, but I think a repeat cesarean is definitely necessary. And I think you also have to look at mental health too. If you have a patient who's like ridden with depression or
Oh,
anxiety,
yeah.
putting them through the labor and birth process, and then expecting them to take care of this baby may not be ideal. So I think,
Yeah.
you can't just judge somebody about, what they're choosing to do for their body. And I think as a convenience, no, cesarean is not convenience because
No.
you can't drive for 6 weeks. You can't lift your
Yes.
baby or anything heavier than that for weeks at a time. Like, you're bedridden for at
Yep.
least the first week, right? And you're in pain.
Oh,
You
yeah.
had surgery. So I think that, the more we talk about it, the more people have who experience births like you did, which is an empowered cesarean
Mhm.
delivery. I think it's so great that you've shared this in our community, and I hope that you can keep spreading the word about it because more obstetricians need to open their eyes to, teaming up with midwives, because to have that care from a midwife before and after the surgery is
Oh, yeah.
irreplaceable. But to
Oh,
have
yeah.
to be in the hands of an obstetrician who is potentially life saving, is irreplaceable too. So I think
Yep.
that, like, the more people know that this can work and this can be a possibility for them if they choose, because not
Mhm.
everybody needs that.
Yep.
I think it's great for us to talk about it and to share. So I really appreciate you sharing your birth story.
Oh, thank you.
I saw your beautiful birth picture that you shared.
Aw.
And I think it's really great. I'm so happy for you that you were able to have this experience this time. Being someone myself who's also experienced trauma in my first delivery, it gives people hope for their second delivery or third, that it can be a better experience, something that is more pleasurable and something that they can remember as positive and not something that they dread or have negative thoughts about. So
Yeah, and even just, I mean, in my own practice, the amount of women I would come across who would talk to me about their birth experience, and it would be so traumatic, and you could tell that they were just like pushing it down because the
yeah,
baby's fine, so
yeah,
I'm fine,
yeah.
you know, and
No, that's
I
not true.
understand. Yeah, I
Yeah,
understand trying to rationalize it like that
yeah,
because you feel guilty that it's like, okay, but the baby's fine. Like, what am I complaining about? You know, like it turned out fine, but it's like, well, we've got our own scars that need to heal
yeah.
as well,
Birth
right?
is
And
emotional, and birth is something that your body is going through. Like, it's not
mhm,
just happening to you, like you're actually doing, like you're going through it, you're experiencing it. It's not just,
yeah,
yes, it's very important that your baby is okay, but it's just as important that you're okay, because you have to raise that child. You have
oh,
to
for
make sure they
sure.
survive.
Yeah, no, I totally agree. And even the amount of women that have, they end up getting, they try to do vaginal birth with like with a breech baby, which I understand. A lot of people
Yeah,
are comfortable with that and can attempt it, but I don't know that they're being, told all of the implications of that and
yeah,
what that could be doing to their pelvic floor and everything, right?
yeah,
So as much as we want to encourage women, um, to make the choice that they're the most comfortable with. So if they do have a breech baby and they wanted to do a vaginal birth instead
yeah,
of a C-section, all the power to them, but they need to be informed as
yeah,
well as to what that means for their recovery, because
yeah,
it's going to be a bit of a struggle compared to, a regular,
yeah,
positioned birth, right?
yeah. Well, it's just like having an empowering obstetrician or midwife
Mm-hmm. Yeah.
allows the patient to make empowered choices and not
Yeah.
choices out of fear. And I think that's the most important. So just quickly, what are two things that you take away from your experience that you would use to help people in your practice as a massage therapist, or that you can share with us for anyone who's going to be planning a cesarean? What are two things that you felt were most important to for people to be preparing for these types of deliveries?
So definitely, regardless of what type of birth you would have,
Hmm.
but with a C-section, I feel like it's a little bit more important, just due to the surgical side of it. But
Hmm.
the the prehab of
Yeah,
birth and delivery, right?
yeah,
So not just kind of taking those 9 months off or scaling back. Do what you feel comfortable with, but make sure that you are training your core and you are taking care of yourself and getting that activity in and the exercise, because you're going to be laid up for a few weeks after the fact, and you're going to need, like, I think of fitness during pregnancy as like an insurance plan, where
hmm,
it's like you have banked all of that exercise.
yeah,
It's still like you're going to store it in your muscles, they're going to remember it, and then when you need it, which would be immediately postpartum, in those 6 to 8 to 12 weeks that you can't exercise, or you can't get back to your regular
hmm,
routine, you're going to have that strength to to kind of bring you through the whole recovery process.
yep,
And it's so important. And I mean, a part of that, you have to find somebody who knows what they're talking about as well,
yep,
right?
yep.
So because there's a lot of crappy messages out there
I know.
online about
Yeah,
what you can do and what you can't do
yeah,
while pregnant. So that would be one. So definitely prehab and rehab. So
yeah,
making sure that you see like a pelvic floor physio, or if you are a massage therapist that has a background in postpartum rehab, then to prescribe it to your patients.
yep, exactly.
Bless.
Oh,
And then and then the other thing would just be to advocate for yourself.
yeah,
If you want something, go figure it out and find out how to get that person on your team, because unfortunately the OBs, most of them aren't going to do it for you. Like
no,
that, they've got too many people to care for,
yep,
and that's just not their job.
yep,
Like really, it's not their job to put together a team for you.
yep,
So the people are out there to help you. You just have to find them, and don't be afraid to recruit people to your team. Like that's what they're there for.
yeah. That's awesome. I love the team
Yeah.
aspect. I had that with my first, and I feel like
Hmm.
that's why I was able to kind of get through my, more of a traumatic experience, because I had a team. So
Yeah.
I think don't just take, like you said, don't take what's just given to you. You can actually build a team outside of what is given by, our healthcare system. So that's really, really great advice. And thank you so much for sharing and for being a part of this. I really appreciate it.
Thanks for having us.
So nice that Emerald has her first live video experience. Oh, she's so cute. I love the name Emerald because I'm a Taurus, and